Hi, everyone, and welcome to Rio Med Spa podcast. I am Sarah Abu Saeed. I'm here with Susan Omar, one of our providers at Rio Med Spa. Susan, can you tell us a little bit more about yourself?
Hi, I'm Susan Omar. I'm a nurse practitioner. I've been in practice since 2018. I've been a nurse practitioner. So, what's that make it? 8 years, actually.
Hmm.
I've been in aesthetics and wellness for the last 10 years and regenerative medicine for the last 12. I've always had an interest in this field from working in oncology. I decided that Western medicine was great, but I felt like there was another avenue to help people be healthy and kind of accomplish their health goals. So I started doing a lot more research and found my way here.
That's amazing. So you mentioned the wellness and regenerative medicine, and this has been like a buzzword all over social media. Anywhere we go, all we hear is like wellness and regenerative medicine. Can you help us like identify what is wellness?
So wellness is a different form of thinking when it comes to healthcare. So instead of you coming to the doctor when you're sick, you're coming more for prevention, where we're going to focus on key markers in your healthcare that will let us know if there's something that we need to tweak, whether it's nutrition, whether it's diets or vitamin deficiencies, or whether it's just simple things like even your electrolyte, like your sodium intake makes a huge difference in your ability to function. So we look at things a lot differently. We can do things like hormones, weight loss, again, like I said, vitamins and, and nutrients. We can do things like peptides, exercise, all of the different kinds of treatments now, which are much more focused on preventing you from becoming ill and promoting longevity of life as opposed to just waiting for you to get sick to treat you.
So, and at what point do you think someone should start looking into like looking to learn more about wellness and how wellness can help them in their lifestyle?
So everybody has different goals in their life. So depending on what they're trying to accomplish, I have young athletes that should be focusing on wellness. So if you have, younger kids, even in their teens, that are, their diets are not so great, but yet they're doing athletics, we focus on that. You have, patients that are in their 30s that are just starting to make changes in their lifestyles and into their diets, and they're working out, but don't really know where to go from there. That's a good place to start. Women in their 40s and 50s, men in their 40s and 50s. So everybody is different, depends on kind of where you are in life and what you want to accomplish. But there's never too early and there's never too late.
Well, having said that, so I've been a wellness patient for about 2, 3 years now, and one of the things that I thought, like, as I'm getting older, feeling tired was something normal, and you know, uh, waking up in the morning and feeling like I'm just dragging myself to get out of bed, and the conception that I had at that time is like, I'm getting older, this is normal. I just have to live with it. Maybe just a little bit of vitamins and I'm going to be fine. Until I got my wellness consultation and I realized it's a lot more deeper than that.
It is a lot more deeper than that. And I think that that's what some people just don't realize is that, first of all, none of it is normal. Our bodies are meant to be optimal. They typically will run, and you're supposed to wake up feeling rested if you've gotten the proper amount of sleep. If you have eaten, you're supposed to be satiated, not sick. You're supposed to have energy and brain clarity. So things like brain fog and fatigue and aches and not really just feeling overall well, that is not a normal part of aging. There actually is no very normal part of aging. Everything can be tweaked when you're when all of your when all of your issues are optimized. So whether it's your blood, whether it's your electrolytes, whether it's your brain function, neural function, if you have things, simple vitamin D deficiency can cause cardiac disease. Simple vitamin D deficiency can cause weight gain. It can cause changes in your immune system. Whereas, most times you'll go to your primary care provider, they give you about 5 to 15 minutes and they don't listen to your issues. So they don't look at these things as abnormal or needing to be optimal. They wait until you have a problem to treat you. Whereas I'm going to look and you're going to tell me these things. I'm going to say, okay, let's deep dive into your thyroid, or let's dive into your electrolytes. Let's deep dive into all of the different areas that could be causing this. and figure out what we need to tweak to get you feeling great for the long term.
So basically, you have to look at the blood work, and I'm gonna say based on my experience, that's how I started. We started with a blood test, and based on the blood test, some of the numbers that looked normal or within the range turned out to be can be optimized. So can you help us a little bit understand more, like how the normal numbers could maybe be a little bit more optimized, and we're not even aware that it can be optimized?
Right. So normal is a difficult word when you apply it to people, because normal for me and normal for you are going to be two very different things. Normal for a 6'4", 280-pound male and a 5'3", 120-pound female are going to be very different things. Also, the standard, it's a wide scale. There's like this big range of numbers where they have found where you're okay, you're not dying at this number. So that's the low end of their normal, but you're also not thriving at that number. So the number that you're going to be thriving at and the number that you're not dying at are two very different numbers. But just because you fall into the normal range, that doesn't mean that it's healthy for you or healthy for someone else. So we kind of really focus a lot more on what's going to be best for someone of your height, your size, very specific and tailored to you.
That's amazing. It's very specific to every single patient. And so we see a lot of ads online, and they're all like basically stating that, come in for a consultation. And based on my experience, some of the clinics usually, like, for example, I went with one of my friends and we both got kind of the same protocols. How do you treat patient differently? Or like, do you have like a specific protocols you go to, or you just treat every case on a case by case basis?
So it's interesting. Even when I teach, a lot of the time students always want a protocol. They want a protocol. Teach me just what to do. They just want the numbers and they want to fit people into a category. And that just medicine and science, it just doesn't work that way. There are some parameters that kind of are standard, but they're for the most part it needs to be individualized. Your individual genetics, your genomics, the way that you process things is going to be very different than someone else. There are very different variables that can make a huge difference in how you process things. Let's just talk about like an MTHFR mutation, which means that you can't process folic acid well. You're not methylating your B vitamins. So something as simple as that can make a huge effect in how your body functions and in the ability of even your thyroid to produce thyroid hormone. So like I said, this all needs to be very individualized and personalized to each patient, because we are all individuals and our genetics are very unique to us.
So what is a typical consultation at Rio Med Spa would be?
So a typical consultation would be you would come in, we would speak. I would start to figure out, your areas of concern, what your goals are. We would set up a lab appointment, get all of the labs done based on what you're telling me and what I need to see. And then you would come back and we would start putting your plan together. So whether it's doing things like fixing micronutrients, or whether it's weight loss, whether it's hormone optimization, even things such as simple as hair loss, that's such a big issue, especially for men and women, that they don't understand that sometimes it's literally you could be iron deficient, and we don't realize these things because our standard panels don't show that. So you need a little bit of a deeper dive. So plan on spending like a good 45 minutes to an hour going over your lab work, putting together your plan, and making sure that we've got all of the bases covered in a way that's actually achievable for you. So you could come in and I could give you a million things to do, and I'm looking at you and I'm like, you're not going to do any of these, are you? So knowing my patient and speaking to them and putting a plan together that actually fits their abilities, and what they're willing to do is another part of what we do. So we spend a lot of time on that.
What are the things that sets Rio Med Spa apart from any other med spa?
So I think it's not that to say anything bad about other med spas. I mean, we can't obviously know what's going on in all of them, but I do know that having been in this industry for a really long time is the attention to detail, the attention to education and furthering education. Both myself and Dr. Noto are passionate about regenerative medicine, wellness, longevity. So we will constantly educate. We'll take all of the courses. We're constantly learning to make sure that we can provide the best care to our patients, the most up to date care for our patients. And I think that's one of the things that sets us apart. The other thing is that we really believe truly that there is no time limit in our visits. We will spend enough time with our patients, making sure they feel heard, making sure that they feel understood and truly cared for, which I don't think I've ever gotten. And that's probably one of the bits of feedback that I always get from patients is like, wow, no one has ever listened to me before. And I think that really sets us apart from other med spas and other providers.
Whenever we go like to Western medicine, let's say to our primary physician, we get in and we usually we see a PA. If we were lucky to see the doctor for like a couple minutes, and the visit is usually maybe 15 minutes.
Right.
They just ask you what are the questions, give you a set of medicine, and they just let you go. And I realized that all the patients that usually come to Rio Med Spa, they usually, spend their time. And also, one observation was some of the patients, they were able to stop taking some of the meds that were prescribed before. How can we maybe talk briefly a little bit about this process that may apply sometimes?
So, in defense of the primary care providers and in those offices, they're insurance based. So they're the money that they're getting back, the payment that they're getting for this is really based on such a short window. Whereas we are not charging astronomical prices, but we are not insurance based. It gives us a little bit more freedom to not have a clock kind of ticking, so we get to spend a lot more time with our patients. The other thing is that being trained in Western medicine, which we all were in order to get a license, it is very symptom focused. So every symptom you have, we have a solution. You have a symptom, we have a solution. Nobody looks for the root cause of disease like we do. So when you come into functional, regenerative, wellness, we're looking for why is this happening? Like if you're having brain fog, I need to know why you're having brain fog. So I'm going to deep dive into that. I need to know why you're having these issues. And just saying, okay, well, you have a headache, here's a Tylenol. No, am I going to send you for a brain MRI right away? No, but I'm also going to look at your labs and say, you're a little bit dehydrated. You don't have enough sodium, or your thyroid is running a little bit sluggish. That's probably why you have dry skin, or whatever the issues are. We're able to literally break them down one by one and figure out what the cause is and start treating you that way and prevent future issues. Whereas they don't have that kind of time.
One of the remarkable things that that you and I were talking about before this podcast was you were able to help some patients get out of depression without even the need to use any medications.
Yeah. So that was with genomic testing. We were able to pinpoint exactly what the area was that was deficient or overstimulated or possibly just not working right. So sometimes there's things called SNPs, and they're a part of our genetics that are sometimes just wired a little bit differently, and they require certain nutrients or certain I would say whether it's hydration or whether it's exercise, all of us are built so uniquely that we can test for these things now and actually create a plan for you that would avoid depression, anxiety, whether you're prone to cancer or dementias or cardiovascular disease. So that's how I was able to help them by figuring out what their deficiencies were, tweaking them, and they felt great with no medication, with never having to get on an antidepressant.
So basically, this genomic testing is basically checking our DNA and what are we holding in our DNA, any kind of maybe future disease or anything that may have happen to us in the future. So maybe we can prevent that. Is that what it is?
Exactly. Yeah, and it's completely unique, and it's a one-time test. So your genomics, your epigenetics is the environment, but your genomics, it doesn't change. So you do this one-time test, and for the rest of your life, you have a roadmap now for health and longevity and avoiding of disease, which is amazing, and there are not enough practitioners that are doing this to help. Where they're looking for, everybody knows about the MTHFR mutation, but there are thousands of others that we can actually look for and use in our toolbox to help give you like a good, happy, long life.
Wow, that's awesome. So maybe we can avoid like getting dementia as we get older. Would that be an option?
That would be an
Oh,
option.
wow.
Yeah, that is actually an option. There are a lot of things that we can do to help, you know, prevent it, and like I said, everybody is so unique and individualized that doing these things can not only prevent, but they can help you decide how you're going to age, right? So you can age poorly, you can age, with aches and pains and in a wheelchair or bedbound or with dementia, or you can age healthy, fit, still able to walk and run around. Are there nuances to all of this? Of course, but for the most part, yeah, we can help give you that.
That's awesome. And would that also reflect on, let's say, the hormone replacement therapy that we hear about it, the NAD, the peptides, all these also new buzzwords that we hear about all the time? Are they also part of like a preventative path?
They are. And the thing that I would probably say scares me the most is that a lot of practitioners, don't fully understand cellular medicine and they're recommending things like NAD and, all of these different peptides without doing the full protocols that should be happening with it. Like something like NAD, you should be doing like a senolytic care prior to doing that because NAD could possibly potentiate your senescent cells to do things that we really don't want them to do.
Mm-hmm.
And if you do like, just a nice protocol and you prep patients for these therapies, you get a much better outcome and it's much safer for the patient.
So you just mentioned about cellular medicine, and we hear a lot about the peptide and the hormone replacement therapy. How are they correlated, and how do they help us in our journey of life to feel better every day?
So when done properly, like I said before, the cellular medicine aspect of it is actually really an important part because being in the education field as well, I get a lot of questions. They just want protocols. People will, you can look all over the internet and people are just getting protocols for, okay, give them this dose this many times a day. And without the proper preparation or the understanding of that, these are signaling molecules and hormones actually are also signaling in our bodies. So
So
if
peptide are signaling molecules.
both hormones and peptides. They're both signaling molecules. Peptides are amino acids. Hormones are also, they signal all different, processes in our body.
Mhm.
So do peptides. So when patients don't, or when patients and providers
Mhm.
don't fully understand the use of these, that there could be adverse outcomes, based on the what signals you're doing, and whether these peptides are taken in the morning or whether they're overtaken or not taken enough, they're not getting the best responses and the best outcomes because they don't fully understand the treatments. But when done well, now someone like me, being 50 years old, I'm still physically fit. I'm very active.
You look great.
Thanks. My skin is still maintaining itself. I've been doing peptides now for 5 years. I've been on hormones since I was in my 30s. When done well, and when you're actually, being cared for by somebody who completely understands what they're doing, you can transform your life. You can transform your body, your skin. You can transform your brain health, your inner health. All of these things are easily done when done by somebody who knows what they're doing. So I think that being careful and just being mindful that a lot of these things that you're seeing on social media are not necessarily coming from someone who truly understands the physical processes that are happening inside of your body and what to look out for. And some patients are not candidates for certain peptides. And if you don't know and you just put everybody on a peptide, you could cause more harm than good. And then nobody,
And
wins
and
in that sense.
and what about the hormone replacement therapy? Is everyone a candidate, or how do we know that we are a candidate?
So hormone replacement therapy, there it really is going to be based. Some numbers are important, right? So we always get baseline labs to look at your numbers. However, based on how you're feeling. So I have 20-year-olds that have to get hormone replacement therapy because they're just not producing enough testosterone. But nobody really knew that, but it was really based on what they were feeling and their symptoms. So if you're a woman who's in their 35 to 50 years old, you may still be having your period, but you might be having hot flashes, you might be having brain fog, and you might be having, shoulder pain, joint pain. Um, and you're kind of like, you've been to your gynecologist, and your gynecologist is like, you're normal, your hormones are fine, everything is fine, you know, uh, lose some weight. That's my favorite one. Lose some weight. That's going to solve all of your problems. And instead, where you could actually possibly be estrogen deficient, or you might have too much estrogen. You may have estrogen dominance. Your thyroid might not be working well. You might not be converting your thyroid hormones well because of something simple like you don't have enough iron, or you don't have enough B12, or you don't have enough vitamin D. So looking at you as a whole, and making sure that everything is optimized matters with your hormones as well. So is everyone a candidate? Possibly, but you're an individual. So there's no cookie cutter for each of you. For every person, it needs to be like very personal.
And it could be at any age. It could be whether you're still in your 20s, 30s, 40s, or 50s.
Absolutely. And because of I don't want to deep dive into the whole environmental things, but there are things that are going on in our environments that are affecting our hormones. Things like air fresheners, perfumes, things in our clothing, our laundry detergents, even things in the atmosphere, in the air, in the food, in our water will actually affect how our bodies are able to produce and use hormones. And it's widely known, that there are hormone disrupting agents just in our regular everyday environment, and sometimes uh, young younger men and women are having hormone deficiency because of it.
But we're definitely going to be diving more into hormone replacement and all what are the causes and how we can treat certain symptoms. So we'll leave that for another podcast.
Okay.
My other question is going to be about peptides, because you mentioned also that it's not everyone is a candidate. Is there any age limit for peptide, or like someone as early as their 20s can get started, or like is there any specific sign that someone really needs peptide?
Well, so age limit, not so much. I mean, we tend to not treat, obviously under 18. However, we have had, children with the consent of their parents, whether it's something like an injury for BPC. So BPC 1.157 is a body protective compound that we use a lot of times to help accelerate healing in
That's
the
my
body.
favorite one.
Which unfortunately right now is on our banned list, but is making hopefully its way back with the new changes soon. But so would I want to do growth hormone analogs like tesamorelin in a younger person who has the ability of producing their own growth hormone? No, but someone who is athletic, someone who is in their later 20s, then yeah, they're working out and they're doing all of the right things, and they just can't seem to build enough muscle. Sometimes we'll check their IGF-1 levels and see what their growth hormone looks like. Sometimes they're just sluggish and need a little boost. So we can do things like manipulate their growth hormone, or we can manipulate their mitochondrial function to stimulate energy. Post COVID syndrome has been huge, where people just can't seem to get out of brain fog. They can't seem to snap out of it. They're just so tired all the time. And it's mitochondrial function, so there's ways for us to kind of signal the mitochondria to start working more efficiently. And that we do with peptides.
So what are the symptoms that someone has hormonal imbalance?
So they're pretty vague symptoms for hormonal imbalance, but they can be somewhat specific. Things like hot flashes, um, brain fog, fatigue, loss of motivation. For women, will tend to have dry skin. You can have something like itchy ears, hair loss.
Itchy ear.
Itchy ears is actually an estrogen deficiency symptom.
Okay.
Things like restless legs, things like achiness, frozen shoulder. For men, it's waking up without a morning erection on a regular basis. It's the loss of desire to do the things that you were doing before. Men are typically, builders, and they're motivated to get up and do and go. And sometimes when their testosterone is low, that actually will die off. So you'll find that men they'll get their work done, and then they'll get home from work and they'll just want to sit on the couch and just veg out and be done. If they have symptoms like that, they may have hormone deficiency. Men also can have changes in their erections. They can have changes in their sex drive, their libido. For women, too, we have libido changes, we have vaginal changes, breast changes. So, all of the things that you can imagine that have to do with hormones are typically going to be your general hormones, but they could be a million other things too. Typically, though, I think it's usually a hormone deficiency.
I know a lot of women, they're not comfortable with the idea of like taking some testosterone.
Hmm.
And I know uh, like how this could be a life changing for a woman.
Hmm.
What do you think of that?
So I've have a lot of women that, were a little concerned over testosterone. Sometimes they were dosed too high, like, if they had been to other providers, they were dosed too high and they're like, "Oh, I grew hair on testosterone," or, I didn't really feel good," or, they have all of these other symptoms. And a lot of the times it's just because no one checked to see if they were estrogen dominant or estrogen deficient.
Hmm.
And there was no balancing done with it. The other thing is that the way that you give hormones to a patient matters. Whether we do injectable testosterone is very strong for women.
Hmm.
Sometimes even one single unit can make it too strong for you.
Hmm.
Whereas they might need something like a cream, and then you have to start, figuring out how to apply it. That's going to be in a way that they'll do. Things like if they're using it for their libido, where you apply it matters. So if you apply it near your inner thighs, near your labia, on your labia, can actually stimulate your sex drive. For men, we tell them to use testosterone cream on their scrotum. It will stimulate their sex drive and their libido. So all of these little nuances matter. And I think that for women who are afraid of testosterone because of hair, it just depends on where we're putting the testosterone. And if they do have that as a symptom, then we'll have other options. We can always do laser hair removal.
And just to clarify, like for the hormone replacement, it's not just testosterone, it's testosterone, estrogen, and progesterone. Am I right?
Not just that, it's also
Okay.
thyroid,
Oh,
right?
okay. Thyroid
So
too.
yeah, we've got other hormones. We've got adrenal
Hmm.
hormones. We've got cortisol. So we're going to be looking at all of the hormones when you come in for hormone replacement therapy. We'll check everything to see exactly what you need specifically and figure out a plan that makes you feel your best.
Oh, that's awesome. Another buzzword that has been also taking over all
Mhm.
social media almost in most of our lives, I would say, everywhere we go, is exosome.
Yeah.
What is exosome?
So depends on where you're getting these exosomes from. So I think that everybody believes that exosomes are stem cells. They're the actual an excretion of a stem cell. They don't have any genetic material inside of them typically. And what they do is they send signals, they send messages, they direct traffic. They're the traffic cop, and they tell people to calm down, slow down, speed up, heal. Don't do this. So exosomes are great. I call them my little heat-seeking missiles because they reduce inflammation really well,
Hmm.
and they cause repair really well. They stimulate your cells to do things for us at a much more rapid rate than they do on their own.
Hmm.
So, exosomes, in that sense, that's what they're used for. But we can use them in aesthetics. We use them in regenerative medicine. We use them in pain management. We use them in longevity care. So, exosomes are great for just about everything. And it depends on where you're getting them from. Sourcing matters, and what you're doing with them matters. I will say that plant-based exosomes, they don't speak our body's language. So
Uh-huh.
yes, they are plant-based exosomes, but they're not human exosomes. So our body doesn't respond to them in the same way that it does to human exosomes. So try not to get sold the myth or the lie that they're going to use plant-based exosomes on you and you're going to have these great results. You're not. We don't speak the same language.
And I've seen also like some videos where like people use like some exosome masks like to help heal the skin, especially after some of the aesthetic procedures like the PRP or the radiofrequency
Mhm.
microneedling.
Yeah. So they're new. And exosomes, typically, when they're derived from the umbilical cord or from the placenta or from the amniotic fluid, they're, you know, they're used topically and like kind of right away. When they're done into the mask, I honestly I need to see more science on them. I think that there are some products that are showing great results, but I couldn't guarantee those yet because
Hmm.
I don't really know enough. I'm still looking for a lot more of that science. I actually prefer real human exosomes right out of the cryo, defrosted, and put right into whatever I'm doing is the way that I like to do things.
Uh, I also, one of the stuff that I've seen also lately is exosome could be also a treatment for hair loss or would help like
Mhm.
restore hair loss.
Yep. Again, to decrease inflammation, to also help heal tissue. So we cause trauma in the area, and then we stimulate new blood vessel growth, new collagen growth to that area. So it helps support the hair follicle to build and repair whatever is causing, excuse me, the hair loss. Sometimes we do it in combination with other treatments and other therapies, but exosomes has been showing great results for hair loss.
So how would you describe the journey for someone? Like, where should they start?
So I think that you should start with a consultation, of course. Come on in. I am always super happy when I get new patients and I get to help them get to whatever their goals are, whether it's to be fit, whether it's to weight loss, whether it's just to feel healthy, whether it's to, fix their memory issues or their hormonal issues. Sometimes I have, couples that come in, so please come in with your husbands and wives. We fixed marriages, by fixing hormone deficiencies and vitamin deficiencies. So the journey starts with our consult, and then after that, we'll figure out what your goals are, get you to your goals, and then hopefully, once you're feeling better, we can even address some aesthetic goals and kind of help people feel good both inside and out. Which is always at the end my favorite because I get to see people really glow and shine and feel their best and just their confidence just booming through the door, which is so fun.
And when you're saying aesthetic, are we talking about Botox and filler?
We're talking about all of it. So there's Botox, fillers, there's regenerative aesthetics, which is more like the PRP, more the exosomes, more the microneedling, lasers. So for people who don't want to do the typical filler and toxin, we have a lot of other tools now that we can use for patients. We have lasers that can give you volume in your lips with no filler at all. We have lasers that can, if you don't like needles, we can use lasers for hair restoration now. We can use lasers for spot treating fat pockets. We can use lasers for skin tightening. Um, we can also do, sexual health, right? So for women who have given birth to children, we can address stress incontinence. We can address vaginal laxity. We can address vaginal changes. For men, we can deal with erectile dysfunction. We can use regenerative aesthetics into erectile dysfunction by using PRP. We can actually give men more size, with some of these aesthetic treatments. We can give women more sexual gratification. So there's just no limit to what we can do. But the only way to ever know what you need and what you want and what we can accomplish is by coming in for a consultation.
Basically, you're saying, come and see you, and then we're gonna feel 10 times better and look 10
Exactly.
times better.
Exactly. Just come on in and get started and let me help you get to whatever you are trying to achieve.
Perfect. Does that mean we're not gonna get age anymore?
Listen, you're going to keep aging, but I'm gonna do my best to slow down that process and help you do it with the most grace you can.
Perfect. That's all we want.
Thanks everybody for listening to our podcast and letting me ramble on and geek out on you guys on all of the wellness and healthcare that I truly enjoy doing for you. I look forward to meeting some of you soon. Please come on in for a consult.
Thank you, Sue.